It's our 11th season, I believe, of Medicine in Our Backyard. And I do have just a couple housekeeping things. Number one, please silence or turn off your phones. Number two, you don't have to record this or take pictures of it because of the support of our donors, we video record these lectures, and they're on our website, including the slides, in about 7 to 10 days. So you don't have to stand there or sit there with the phone up here going click, click, click. We do that for you. The foundation is really an important part of the library community. Besides the programs we do and the funds we raise, last year, between program and direct funding, we were over $350,000 in support for this library. As always, I want to thank you for coming this evening and thank our valued partner, UCI Health. They've been our partner from the beginning, and what they bring to this series with the advancements and the researchers and the knowledge they have is really something that is just so critical to our community. As always, we want to thank our founding sponsors, Mike and Polly Smith, and all the members of the Library Foundation. It's with their support that we will be able to do this program and so many others. In fact, this year, we will do 49 programs for the library. And 37 of them are totally free. In addition to this series, we do a financial literacy workshop, which starts soon. This spring, it focuses on estate planning. We have a book discussion group led by Kunga Wangmo, who is the program director and works on all these programs. That meets monthly. And then our newest free program, Spotlight on Science. Now, this March 5th, Spotlight will have Dr. Grant McGregor, who is also from UCI Health. He's a professor at the UCI, I want to get this right, Charles Dunlop School of Biological Sciences, and he's going to talk about CRISPR. It's gene editing. Now, here's the thing. You've heard about gene editing, and I keep thinking, how do they do it? Little tiny knives in there? So it is going to change medicine and health and so much of what we do, but he's going to be here to talk about it. And then April 30th, we have Lucy Jones, who will be, the renowned seismologist who will be talking about tectonic activity in California, earthquakes, the last thing we need at this point. You've all seen the progress of the construction of Whitty Hall. The bones are up there. It's been 10 years in the making. And it's not just for the foundation's programs. It's not just for the library's programs. It's going to be available for any community organization to host a presentation, a music concert, a film, anything that people need a really state-of-the-art facility for, it's going to be available to them. Now, here's the situation. Our agreement with the city is that we're going to raise 50% of the funds needed to construct the hall. Our share is $12 million. And we're nearly there. Happy to announce we have an anonymous donor who has made a matching gift challenge of $500,000 for every new and increased gift. So every gift you make goes double. So if you've not joined us in support of the hall, please talk to me. You can, anytime. Visit the Whitty Hall tab on the foundation's website to learn more. It's going to be quite an important building. Here's the other thing I think of it. We come together here as a community to learn from each other, learn from experts, and this will just give us another opportunity for the community to come together. And in the Atlantic magazine this month, it talked about antisocial society. If any of you, just quick side note, a number of years ago, a man by the name of Robert Putnam from Yale University wrote an important book called Bowling Alone. And it's about how so much in our communities we're now separated. We're not meeting and being part of one community. So that will certainly help us. That Whitty Hall will certainly help us be part of one community. Tonight's topic is integrative health, nutrition, and food allergies. Social media is awash with a lot of information, misinformation, disinformation about nutrition and food allergies. But tonight, we have a board-certified gastroenterologist, I learned how to say that word, to give us the real intelligence about what works and what's the recent research. Dr. Kiran Sachdev is a UCI Health gastroenterologist, and her clinical interests include esophageal disease. Did I say that right? Esophageal? Esophageal. Close. Gastrointestinal functional and motility disorders. I don't know what those are. She'll explain those to you. Obesity medicine and integrative health. She earned her medical degree at Maulana Azad Medical College, good, in New Delhi, India. Completed a residency in internal medicine at the Albert Einstein School of Medicine of Yeshiva University in New York City, followed by a fellowship in gastroenterology and hepatology at the University of Connecticut School of Medicine. She also completed a fellowship in integrative medicine at the Academy of Integrative Health and Medicine in La Jolla, California. After Dr. Sachdev's presentation, there will be a brief question and answer period, and I ask you to please keep your questions brief so that we can have as many questions as possible. Remember, this session is being recorded, so be careful about what you say about your own health. And now, please welcome Dr. Kiran Sachdev.
Thank you so much for that wonderful introduction. And today here am I in this place to talk to you about not just GI. I'm a board-certified gastroenterologist, but I'm also board-certified in integrative medicine. So I kind of, for 28 years, to give you a brief introduction, was doing general GI most of my life. And then I realized that, yes, I'm very interested in patients' history, what happened to them, the trauma they've undergone, why are they having the disease. I'm giving them some supplements, I'm giving them lifestyle, food choices, but I really cannot get into the nuts and bolts. Why are they suffering this problem? Why do they have all these associated symptoms? And why can I really treat them? Why can I get them to their place of maximum well-being, the place of maximum health? And then I embarked on my journey in integrative medicine, and here I am. So I'm going to talk about why focus on the gut. The most effective clinical outcomes across all disease spectrums can result from normalization of the gut function. The gut is not just me saying that. This was 2,400 years ago. Hippocrates, the father of medicine, said, all disease begins in the gut. Root cause medicine is what I focus on. And it's like I would tell my patients, it's like peeling the layers of an onion. If you have a disease and you have all these symptoms, we need to peel those layers of the onion to get the root cause of why you're suffering that disease. And that basically is focusing on the microbiome. And what is the microbiome? Microbiome is the entire bacteria, viruses, fungi, a separate ecosystem, not living there in the Amazon, but actually inside our own bodies. And it's like around 38 trillion bacteria or 39 trillion bacteria. It can be viruses, fungi, parasites. All of them are living in harmony. That is a healthy gut. When they get disharmonious, something happens bad, like an infection. You go out, travel somewhere, you eat something bad, or you get a viral infection, say an upper respiratory infection. That can even affect your gut microbiome. So again, the microbiome is got 100 to 100,000 times more genes than the human body does. So imagine we all have this ecosystem in our bodies, and it doesn't obviously stay the same. It is modifiable. That's why we like the human microbiome as opposed to your genome. Your genome can be modified to some extent, but your genes are mostly the same. They don't change. But the microbiome changes during every phase of life. So gut contains almost 70% of the immune cells. The GALT, or the gut-associated lymphoid tissue, is 75% or 70% of the whole body's immune system, and it resides in your gut. 80% of the neurotransmitters, you all know about the gut-brain axis, they are produced in the gut, and they affect the brain. They go to the vagal nerve, and the vagal nerve goes into the insular cortex, sends the signals back, and that's all coming from the gut. It has metabolic activity, which is greater than the liver, which is one of the biggest organs in the body besides the skin. So it has the function and the capabilities of doing a lot of things that we did not understand before. And now with more research, we're understanding what is happening. So what is a healthy gut? And I would like to outline the last two things on this slide. A balanced host bacterial ecology, which means the microbiome inside me has to be calm with my nervous system, with my tissues, with my cells. Then I'm in good health. Autonomic balance. The signals it is sending to the brain have to be calmed down. And that's how the microbiome works. And it flourishes and it nourishes almost every system of the body. What is an imbalanced or a sick gut? Poor diet, SAD, the standard American diet, dehydration, all these medications we're put on. Infections can happen along the way. Toxins, we're day in, day out, we're exposed to toxins in the environment, in our food, molds, different kind of foods that we're allergic to, inadequate digestive enzymes, impaired ecology or imbalanced ecology, imbalanced microbiome, which is the basis of mostly a lot of all diseases in the body. Impaired intestinal permeability, what is that word? Leaky gut, we've heard of that. The tight junctions in your small intestine no longer are tight. Bacteria, viruses, antigens are now penetrating through the gut, and they're actually causing something called molecular mimicry. The antigen permeates into the gut. It is same molecular mimicry as my knee cartilage. Now my knee starts hurting. Why is my knee hurting all of a sudden? It is your gut dysbiosis which could be causing that. And altered neuroendocrine balance and autonomic function. We know anxiety, depression, a lot of these diseases are related to the gut. We're finding out in Alzheimer's, Parkinson's research, there's dysbiosis going on in the gut. So we really need to focus on not getting this sick or imbalanced gut. So again, these are a myriad of issues which can happen: heartburn, ulcers, inflammatory bowel disease. These are the diseases that can be a manifestation of gut dysbiosis. So this is a slide of a person with irritable bowel syndrome. It affects almost 25 to 45 million people in the United States. It is the leading cause or second most common cause of missed work. What are the Rome criteria? So a bunch of guys got together, or gals got together in Italy, and this was probably in the 1980s, and they decided they wanted to define this irritable bowel disease, which is basically abdominal pain, which is associated with some form of altered defecation, whether it's frequency of stool or its appearance of stool. So that's kind of the Rome 4 criteria. And this is excluding when organic disease has been excluded, you're still having pain, and you're having some change in bowel habits, and they're always associated together. That is irritable bowel. So what causes irritable bowel? Our diet, standard American diet. Intolerance to food antigens. 50% of people with irritable bowel have some intolerance to food. Food is becoming genetically modified and is almost becoming like a chemical in our own bodies. A lot of stress. All the time we are under stress. People have anxiety. People have emotional stress, physical stress. Infections. We're exposed to infections day in, day out. Those infections, we might take antibiotics. We wipe out our gut microbiome. If in itself, the infection might act as a trigger for intestinal permeability and also might affect that ecological system in our body, that ecosystem which is in balance, causing imbalance. Motor problems. Either the gut is not moving too fast or the gut is moving too fast. People with constipation. That is a part of irritable bowel syndrome. So to get to how do I really dig in? How do I get to the root cause? How do I peel the layer of the onion? It's a dig in approach. I approach the gut in terms of its functions, okay? One of the functions is basically to digest all the food that we're taking in, make it into small nutrients, and the nutrients need to get absorbed. So digestion or absorption issues. People can have those as the primary cause of their problem. Intestinal permeability or leaky gut that I talked to you about before. Again, the gut microbiota going into chaos in relationship to the host, and that's called dysbiosis. Immune modulation, inflammation. We are all living in this metabolic obesity era where there's a lot of inflammation in our body, which is actually creating this metabolic diseases, the obesity, cardiovascular disease, that is often a result of inflammation. The nervous system. The nervous system is not in balance. Why is it not in balance? Because it is constantly, the gut is getting bombarded. There's dysbiosis in the gut. There's leaky gut. The gut is not making the neurotransmitters it needs to make. Over a period of time, maybe there might be multiple sclerosis. There might be a trigger for Alzheimer's. Something is happening between the gut-brain axis. So impairments of digestion or absorption, and this is just to give you guys a little bit of a slide. The mastication is, we need to chew. We need to chew at least 13 times before we swallow food. Why? It triggers your salivary amylases. The salivary amylases actually digest your carbohydrates. So chewing or mastication is an important part, the same way as we talk about sleep hygiene. I need to talk about food hygiene. We need to sit down. We need to close our computers, not look at anything. We need to chew our food, swallow. This is important because then the cephalic phase starts. We start becoming more hungry. So chewing food is the beginning of digestion. Then comes the hydrochloric acid in the stomach, and that's the first barrier. So we don't think hydrochloric acid is an enemy. People always think, oh, I have too much acid. No, it's not always an enemy. In fact, as we age, we actually don't produce enough hydrochloric acid, and this goes against my traditional thinking with the PPIs and all the stuff that I used in the past. I don't use them that often. I think about people having low hydrochloric acid, not digesting the food, pathogens getting into their gut, they're becoming more susceptible and vulnerable to infections. That is the role of hydrochloric acid, and that is something we check on gut microbiome testing that I will further show you guys. And then there is enzymes, and these are the pancreatic enzymes. The pancreas lies right behind the stomach, and it produces these enzymes which help digest starches, fats, proteins, and amino acids and everything. They break down the stuff. They perform a very important function. The pancreas itself can get atrophic. There can be chronic pancreatitis due to prolonged alcohol use. There can be issues with the pancreas from the gallstones. Numerous things can cause exocrine pancreatic insufficiency. Then the fourth thing, which is important for digestion, is the bile, which is produced by the liver. Now, the bile, 95% of it gets absorbed, 5% maybe gets excreted in the stool. But in some people, when the gallbladder is not there, the gallbladder is your U-Haul, which stores the bile immediately rushes into the intestine. It causes increased osmotic load. It causes diarrhea, and that's called BAD, or bile acid-related diarrhea. So I'm just touching a little bit on the digestion issues, and I'm going to keep talking because I have plenty of slides, but at 7:40 I'll stop for questions. So we are in this age of inflammaging. Again, we're saying this inflammation. If you eat the standard American diet, it taxes the gut microbiome. Inflammation, our immune system gets activated thinking, oh, wow, why is there so much of dysbiosis going on? Why is there food and these antigens which are not supposed to cross the gut barrier? Why are they leaking inside our guts? If they're leaking inside our body reacts saying, oh, is this a friend or a foe? Oh, it's definitely a foe. And if it's a foe, it starts this inflammaging, or the immune system cascades start, and we get into inflammation. So this is the prep that I like to see when I do my colonoscopies, a nice clean prep, but this is what normally the gut microbiome looks like. This is a bad bowel prep, but this has 38 trillion bacteria, fungi, protocysts, archaea, and viruses all in this gut. So this is a little slide on, let me just go back. I can't do that, okay. Okay, well, it's not working. We'll go into the next slide. So what is dysbiosis? Dysbiosis is not so much about the microbe itself, but it's about the effect of the microbe on the susceptible host. So imagine you all are all my friends. You're hanging around the gut. Somebody comes and starts disrupting the whole place. You people scatter off. I'm the host. So now there's dysbiosis between the host and the microbiome around me. I just wanted to explain how dysbiosis works. So what causes gut dysbiosis? Poor dietary choices, sedentary behaviors, high levels of stress, inadequate sleep, your circadian rhythm is off. We are all stressing, we're not even relaxing, we're not going into the parasympathetic state of rest and digest, which we should when we sleep at night. We're still in hypervigilance mode. Our sleep is disrupted. That affects gut microbiome. If we eat foods that we don't need to eat, which are high fat and high refined sugars, that disrupts the gut microbiome. They don't like it. They need to be fed healthy foods. They need fermented foods. They need prebiotics. They need probiotics. They need fiber. They just don't need the processed foods that we all eat. Sedentary behaviors, no exercise, sleeping a lot. There it disrupts the gut microbiome. So what we eat really influences the population and the metabolic activity of the flora. So it is like, imagine you guys are all sitting in the room. Right now you're not working, but then you have to start working. So that's what the microbiome in our gut does. It has a lot of functions. It has metabolic functions. It helps with the growth and stimulation of the cells. It prevents cancer from forming. It releases metabolites from called short-chain fatty acids. And those short-chain fatty acids, they make the microbiome environment acidic. And they basically exert a trophic effect on all the cells around them. So they are the source of fuel to the colonocytes or the colon cells. They affect the gut-brain axis by releasing neurotransmitters. They increase the motility of the gut. Short-chain fatty acids will help people who are constipated. So those are the post-metabolites. So that's the functionality of the group. So if you start performing a certain function, that function, it leads to these things which are called post-metabolites. And that is the metabolome, or it's the function of you guys as a crowd together, or the function of the microbiome. So these are the activities that I was talking about, that the microbiome has metabolic activities. It ferments all the non-digestible residue, releases these bright new shiny particles which really help the gut. They're called short-chain fatty acids. It helps in production of vitamins, vitamin K, vitamin B1, vitamin B2, B7, B9, which is folate, B12. The microbiome itself is a factory which is constantly processing the vitamins, which we want to, obviously we take extrinsically, but we know something is going on in our gut. It has trophic activities. It controls epithelial cell proliferation, differentiation in the colon, so it might be preventative for colon cancer if you have an adequate microbiome. Immune activation. It educates the immune system what is friend or what's foe. We eat so much of food. Some of us don't like that food. That might be foe to us, and some foods are friend to us. So they create an oral tolerance. So we're able to eat more variety of foods. That is by affecting the immune system. They have protective activities. So basically, you guys don't want anybody else to come into the room. So that's how they act. The microbiome itself, it prevents any outsiders or invaders or pathogens from coming into the room. So it has protective activities. By this act of competitive inhibition, it prevents them from residing in the gut. It has neural signaling. It produces these metabolites, the histamine. It produces also 5-hydroxytryptamine, serotonin. The serotonin, the GABA, and the tryptamine, they help with the brain, bidirectional neural signaling to the brain. So the power of microbiome is diverse. The microbiome is not a static thing. When we are born, we get the microbiome from our mother. If you have a C-section versus a vaginal delivery, it reinforces the microbiome of the child. If the child is getting breastfed, that again reinforces the microbiome of the child. By 3 years of age, now the child finds their final microbiome. But as we start aging, we become adults, the microbiome becomes more diverse. And now when we start aging, and I would say as I start aging, my microbiome becomes less diverse. So that is an important part to think about. So there's a guy called Martin Blaser, and he wrote this book, Missing Microbes, and he talked about the relationship to our modern plagues. And what are our modern plagues? They are diseases like obesity, type 1 diabetes, asthma, allergies. These are inflammatory bowel diseases. These are the plagues of this 21st century, which are outnumbering us, which before I would see a few inflammatory bowel disease patients, every week I almost see like 3 inflammatory bowel disease patients. So as I can say in my practice, this is growing, and it is related to gut dysbiosis. Often when we are taking antibiotics, people don't realize it is not just wiping out your good microbiome. It is actually your bad microbiome wherever the infection is, but it's also wiping out the good microbiome in the gut. That's why the use of antibiotics should be done with caution. So the composition of the microbiota obviously shape the healthy immune response to predisposition to disease. So that is dependent upon your lifestyle, diet, stress, which affects dysbiosis. As I said before, early colonization, births in hospitals, medical practices, giving kids antibiotics too often, even doing too much of, clean hygiene. There's a study which says that if the kids were hand washing the dishes as opposed to the dishwasher, those kids which were hand washing the dishes in the house, they had a better microbiome than, washing dishes in the dishwasher. So it's a funny thing, but I just had to bring it up. That too much hygiene is also, so the 5-second rule holds. Okay, just had to say that. So causes of intestinal dysbiosis, again, it's a SAD diet we talked about, which is low fiber, high in fat, and simple carbs, broad spectrum antibiotics, chronic maldigestion. If people are using PPIs for years and years and years, those PPIs suppress the hydrochloric acid. When they suppress the hydrochloric acid, those pathogens say, yay, we want to get a straight path in. There are no soldiers in the field left anymore. Chronic constipation. If people are not moving their bowels more than 3 days a week, that's chronic constipation. And that can lead to slowness of gut transit. So the microbiome just sits there and it festers there and it gets dysbiotic. Stress suppresses the good bacteria, lactobacillus bifidobacterium, your secretory IgA, which is your immune response, and catecholamines, your catecholamine response, fight and flight response. It increases the growth of gram-negative bacteria, which are kind of bad for you, like Yersinia, Pseudomonas, or gram-negative bacteria. So this is a classic patient profile of a patient with intestinal dysbiosis, where it is not just the gut, but it is all these symptoms: brain fog, lack of sleep, anxiety, headache, bloating, joint pains, just not feeling good, mood swings, anxiety. So all this can be related to dysbiosis in the gut. So does the microbiome control us, or do we control it? That's the question. When gut bacteria change brain function, we're coming to a new point where we're realizing memory loss, Parkinson's, all these multiple sclerosis, the trigger lies within the microbiome and its interaction with the host, or with dysbiosis, or with intestinal impermeability changes, or with like all these food antigens that 50% of us have developed food allergies, That is an important part to think about, that all the foods which are getting genetically modified and they're being sold in mass quantities to us, and that's what we're eating. So think organic, think a lot of fiber, think less processed, think less refined. So this is the emerging diseases that I talked about, where human gut microbiota can lead to this, this modern plague, and the plague is emerging infectious diseases. COVID is more in patients with gut dysbiosis. Their predisposition towards COVID was much more. Metabolic syndrome, obesity, hypertension, atherosclerosis, diabetes, inflammatory bowel disease, something called fatty liver, that is all related to gut dysbiosis. Let's see if this plays. How do you know if you have leaky gut? Is it playing? Yeah, okay. Digestive issues. This is increased intestinal permeability, which is that gut lining becomes leaky. So the barrier which prevents the people from crossing into this room becomes leaky. So people start invading the room. They cause skin issues. They cause autoimmune conditions, joint pains, as I said, knee pain with molecular mimicry, fatigues, headaches, mental health issues are associated with it, anxiety, depression, brain fog, systemic symptoms, malaise, low energy, generalized inflammation. These are all the things which can start with this entity, which is leaky gut. And what is that? This is a healthy gut. And if you look at this, we see the the barrier is tight, or these are good fences, and these villi are tight, and there's no way things can get in unless we allow them in. Our immune system allows them in. But this is what happens with leaky gut. They're damaged. Villi are in your small bowel, they're damaged, these junctions get leaky, and so things start crossing over, things which normally we should not able to introduce into our system, those cross over. Pathogens, infections, food antigens that we might not be able to tolerate, they cross over, and they cause this incredible response, and this is inflammation. So these pathogens cross through the cells, or they cross paracellularly, and then there's inflammation going on in the gut lining. So genetic for autoimmune conditions, I really wanted to say, like we're looking at the gut microbiome, we're looking at certain cancers, we're definitely looking at autoimmunity. Autoimmunity is on the rise. Our body is attacking ourselves. And that is often related to, obviously, genetic predispositions, certain environmental factors. It could be our exposure to toxins like glycophosphates, lead, mercury, whatever is in the microbiome, and then, which is in the environment, and then an altered gut microbiome with gut inflammation. That increases the chances that your gut becomes leaky, and all these macromolecules, bacterial byproducts, they start crossing into that lining. There's a systemic, the whole system, immune system goes haywire. And now your body starts reacting on its own to itself. So autoimmune diseases, Hashimoto's thyroiditis, rheumatoid arthritis, these are all diseases that, multiple sclerosis are autoimmune diseases, and they're on the rise. So what is the other part of the gut? As I said before, 80% of the neurotransmitters are produced in the gut. So what do we know about the enteric nervous system? It's the second brain. It is actually better than the brain, but it is the second brain because we can change this brain. We can't really change, I guess we could change our own brain too. But the microbiome, if you modify it, it can affect the brain directly through the vagus nerve. So the enteric nervous system, what do we know about it? There are 100 million neurons, which are called the enteric nervous system, and they're present in the gut, and they produce neurotransmitters, and they act through the vagus nerve, which is known as a wandering nerve. It supplies almost every part of the gut except the most distal part of the gut, and it takes all the information to the brain, to the insular cortex, and say, hey, I'm not feeling good, I have pain, or I feel this, something is bothering me. Can we amplify the signal? In some people, that signal gets amplified. So their system becomes hyperalgesic, or even if the stimuli is not that noxious or painful, but those people feel it amplified because of this gut-brain axis disorder. And that sometimes is called visceral hyperalgesia, which means if I had to take your hand and put it in hot water, my skin threshold of pain might be lower than yours, but my gut threshold for pain might be much, much lower than normal. And that's visceral hyperalgesia, which plays a big part in a bunch of disorders which are called the functional gut-brain axis disorders. So how do I really do this? How do I work from my traditional training into looking at the microbiome? It is it's called a comprehensive stool analysis, and it tells me all these markers. And what do I get? Who would benefit from the testing? And not a single person in this room can I say will not benefit from the testing. So it is for digestive issues, if you have difficulty losing weight, if you have joint pains, food allergies, poor sleep pattern, you're falling sick very fast, you just can't focus, you have brain fog, you have autoimmune disorders, you have issues with hormonal imbalances, either it is, excess estrogen, low estrogen, skin breakouts like acne, rosacea, psoriasis, mood swings. See, all of these people. So I'm not just talking to the people with gut issues. I'm also talking to people with all these other issues, how the gut microbiome can translate and help fundamental issues in the entire body. Because it helps with producing nutrients. And these nutrients get absorbed and they affect almost your cardiovascular system, they affect your brain, they affect, the nervous system. So they affect almost every system in the body because every system in the body needs nourishment. That's why we begin in the gut. So why care? A healthy gut is crucial for strong immune system, cardiovascular system, brain health, sleep, mood management, weight management, how do you synthesize, excrete hormones, and effective digestion, of course. Your gut influences the health of gut in every body and every system of your body. And we are trying to get to the point like of optimal health, where everybody feels good, where all systems are balanced. And that's where integrative functional medicine comes in. We believe in a system biology approach, where from one system we can influence or we can connect the dots in all the systems in the body. So the stool testing is not created equal. In the past, the stool testing I used to do was a stool culture. It just told me there were some organisms present in it or not present in it. Stool microscopy, checking for ovum parasites. But the stool testing that I now do is a very sensitive stool testing. It's a qPCR, or quantitative PCR. So it detects small amount of DNAs of that bacteria in the stool sample. So it's not just telling us, okay, what bacteria, there is a bacteria. It tells us to the DNA amount, 10 to the power of E3 or 10 to the power of E8, how bad is the dysbiosis in the gut. So the testing that I use, and there are different methods. We do 16S ribosomal testing. There's the GI map testing, which I talked about, which was the qPCR technology. So it helps to determine, is the gut inflamed? Are there autoimmune triggers? Are there certain bacteria in the gut which are autoimmune triggers? Is there dysbiosis? Is there chaos going around in the room? Is there low hydrochloric acid in the stomach, which is initiating the chaos because it's allowing all the pathogens to break through into the system? Is there gliadin reactivity? Is there reactivity to wheat, not just celiac, but also non-celiac gluten sensitivity? Is there balance in the ecosystem in the gut? Is there some kind of maldigestion? If food does not get digested, then it becomes fodder for the bacteria. The bad bacteria proliferate on the undigested food. So maldigestion is really important to treat. How is the immune function of the gut doing? Is the gut leaky? So what can we learn? As we said, it tells us all these categories. It tells us about pathogens. It tells us about H. pylori, which is very, very common bacteria, and it can actually cause gastritis and ulcers, and it can affect your hydrochloric acid, and it can lead to increased infections. What are the commensal keystone bacteria? Who are the bunch of people who are doing good work in your body? What is their levels to the whichever degree, we need to know. It tells us about phyla. Your Bacteroides firmicutes phyla are the ones which are more predominant as we get older. So it tells us the population here, okay, who is wearing yellow shirts, who's wearing blue shirts, so it tells us the population of the good guys, and it tells us the population of the bad guys. Bad guys are the parasites. It tells us about, your enzyme productions. So elastase is an enzyme which is marker of pancreatic, function. The beta-glucuronidase is an enzyme which is produced by the bad bacteria. That basically effectively detoxifies estrogen. So if people are having premenstrual mood disorders or endometriosis, they might have high levels of beta-glucuronidase, and they might not be excreting their estrogen in the poop. They actually are storing it in the body causing a lot of reactions. It tells us about the immune system, which is a secretory IgA. It tells us if you're reactive to wheat. Eosinophilic protein X is another marker of inflammation. Calprotectin is another marker of inflammation. Zonulin is a marker of leaky gut. So these are the things that I kind of look at the gut microbiome testing when I further assess what is going on. It tells us about opportunistic bacteria. Opportunistic bacteria are not necessarily bad, but if the beneficial bacteria are low, then the opportunists say, yippee-doodle-doo, we're going to swarm the place around. And when they start swarming the place down, they dig their claws. They're tenacious, and they can lead to a lot of autoimmune diseases. So again, we went back to the slide, and these are a couple of autoimmune diseases. I won't go into detail, but they're Citrobacter with rheumatoid arthritis, Klebsiella, which is a pretty high histamine producer, Mycobacterium avium, Proteus mirabilis, which is again very inflammatory, associated with rheumatoid arthritis, spondyloarthropathies. So there are different diseases that these bacteria triggers for autoimmunity. So general considerations, how do I treat these people? For people who have, if there's high amount of, good bacteria around, and less amount of the bad bacteria, but the good bacteria are not in total balance, then I might give, antimicrobials. I don't use antibiotics for the most part. I use herbs like oregano, thyme, garlic. These kind of herbs is what I use to create balance where there's no balance. And that is through antimicrobial herbs affecting the digestion. In certain cases, using probiotics, not with everyone, again, with some people. Generally with high commensals, I would not add probiotics in the beginning. I would use probably antifungal or antimicrobial. I would change their diet, remove the refined sugars, things which are feeding that dysbiosis. Then there can be consideration for low commensals. If, there are not that many people in the room, we need to improve that quality of people in the room. How do we call for them? We give them fermented foods. We give them prebiotics, which are basically, and I'll tell you a little bit more about it later, we increase the dietary intake of macronutrients, carbohydrates, fibers, proteins, making sure they're well-balanced diet. The broad spectrum probiotics that we can give them, most of them in the lactobacillus and the bifidobacterium species. So functional medicine approach for me is, and will go through these tests, first is remove. I try and remove things that I can, the SAD diet, I try and remove their toxins, I try and remove, if there's any medications that they're taking, which is altering the gut microbiome. Then I work on replacing. So after I've removed, I need to replace back. I need to replace back the good bacteria. I need to give them pre or probiotics. I need to re-inoculate. Re-inoculate is a weeding, seeding, feeding mechanism. Then there's repair of that intestinal lining. And then there's rebalancing, getting the nervous system into balance with the gut. So these are the 5 R's of the treatment protocol that I use. So 5R, remove things that negatively affect the gut, which could be food, it could be infections, it could be medications. Replace is give them digestive enzymes. A lot of us need digestive enzymes, and we don't realize that if we have SIBO, that destroys the brush water enzymes in your small bowel, and you can't digest carbohydrates or you cannot break down proteins. So we need to give digestive enzymes specific for SIBO, or if there's pancreatic insufficiency, or if we have low hydrochloric acid, we need to replace that hydrochloric acid with enzymes or with, combination of different enzymes. We need to support the bile, especially in people when they don't have a gallbladder. Then is repair. We need to heal the lining of the gut. We need to give certain nutrients which would help heal the lining of the gut. And these are a couple of nutrients that we give. Omega-3 fatty acids, vitamin D, L-glutamine. That is the stellar most important thing for healing enterocytes or healing the gut. It increases the villus or the villus length in your small bowel, improves your absorptive capacity. It helps with the immune system. Zinc is really important. Most GI diseases, patients are lacking zinc. Vitamin A is a very important foundational blocker, and we need to get adequate amount of vitamin A. We can use probiotics. We can use demulcents like licorice, marshmallow root, slippery elm. So these are the things that I've incorporated into my practice. So good fences make good neighbors. We need to have good fences in our gut so we prevent those bacterial pathogens from getting inside our gut and creating that inflammation or creating that severe inflammation, triggering that autoimmunity. And then re-inoculating. We need to put back the good bacteria in. They are probiotics, prebiotics, and fibers. And we'll just go into that a little bit more. So, and then the 5th most important thing is to rebalance our nervous system. Allow it time to calm down, to go in the parasympathetic mode of rest and digest that happens at night, so that our gut does its own digestive process. It moves around, it has peristalsis, it moves things along, it helps digest, break down nutrients. A lot of it happens at night. So sleep, movement, nutrition, stress are very important part of the protocol. And generally, when I first approach the patient, I go into the remove, the diet, and I go into the rebalance. And then I start working on other parts of that protocol. So these are a couple things that I spoke about. So who's directing whom? Well, it appears that the mammalian immune system is intended to control the microorganisms, but in reality, the microorganisms control the immune system. So there is no dictatorship allowed in this body. So let food be thy medicine, and let medicine be thy food. So food, again, a diet, a Mediterranean diet is your core diet, a diet which is full of healthy fats, which has got legumes, which has got nuts, which has good sources of fiber, a little bit of poultry, a lot of olive oil. That's the food that we're aiming for, and that's Hippocrates. So just to go back, I know I had to talk a little bit about food allergies, so I'm just going to, how are we doing with time? I think we are past my time, so we can talk about that another time. Sorry, I was so engrossed in it, so.
You know, I really, I was just engrossed. So we'll have some questions and answers as I remind people. Please keep your questions short so we can get in as many questions as possible. And if you raise your hand, Kunga will come to you or I'll come to you. Kunga?
Thank you for the lecture. What do you have to say about how microplastics, nanoplastics are affecting human health and human disease, the human gut?
I think they're everywhere. And,
Use the mic. No, use the mic so we can record
I
it.
think microplastics are everywhere, and they're affecting us in ways that we don't even know. And I think they're causing gut dysbiosis, they're increasing your intestinal permeability, and that's one of the things which we can't get away from. Like we can't get away from glycophosphates. I think we cannot get away from that.
Okay. How much of this is like a standard when you come in the office and you test almost all of this for everybody? Or do you go by their symptoms, and are there any insurance plans that cover any of this?
So insurance plans generally don't cover this gut microbiome testing. So it's only for people who have reached their, so the patients I see are people who've seen 3 or 4 other physicians. And they're at the end of their tether, or they want to improve the quality of their life. So I do Gen GI practice too, which I did for a long, long period of my life, but now I'm more focused on integrative health because to me it gives more answers. Yes, it is a budget-based thing, and I have to be very cautious about the supplements I prescribe. Generally at Susan Samueli, where I work, if you're Medicare age, this test is covered. Yeah. Mm-hmm. Well, I didn't want, listen, I'm there too, so.
Can you identify a few things that are important to do to prevent the occurrence of these types of diseases that we can do in terms of diet modifications now?
So for Crohn's disease and ulcerative colitis, I do tell patients to really clean up your diet, whether it's gluten or remove dairy. They're very inflammatory. And then you can start looking for food allergies and food sensitivities. Definitely vitamin D is a very important part. Using, anti-inflammatory things like boswellia, curcumin is a very important part for Crohn's disease. There are some supplements that we give patients, but really focusing on looking at gut dysbiosis, like analyzing the microbiome and resetting it, whichever way we can. I think that's an important part, but using omega-3 supplements is a really important part in a patient with Crohn's disease.
Are you accepting new patients, and how long is the wait to get an appointment? We've had that problem with many UCI doctors.
Well, I only started here like a year and a half ago or something like that, but I am booking out into May, though I tell my patients I have cancellations every day. So yes, I am accepting new patients. Sure. So, there can be food allergies, which is an IgE-mediated response, like asthma, or an acute urticaria. Then there are food intolerances, and food intolerances are non-immune mediated. And this can be like lactose intolerance, it could be intolerance to histamine, high histamine foods. So those are food intolerances. FODMAPs are food intolerances. And then food sensitivities are a little bit more prolonged. They're not like acute allergies, like if you get an allergy, like you get an instantaneous vasodilation, urticaria, all that stuff, but it's an IgG-mediated response. So it can happen 2 to 3 days after you eat the food, and it might last longer, and it might have more systemic effects, not just local GI effects. So those are food allergies per se. And celiac is one of them, to think about it.
Hello. I noticed that you mentioned a lot of dietary interventions that you do with your patients. Mm-hmm. Are there any significant measurable behavioral interventions that you found have been successful?
So, measurable behavioral, we can do, there are certain apps that I use, like, Nirvana is, there's a Nirvana app that I use, a Mahana app that I use, which is for mind-body stress reduction. I do, definitely tell patients yoga, exercise, acupuncture, these all go together, and they definitely do help with this functional gut-brain axis disorders.
I want to thank Dr. Sachdev for coming.
Can I have one more question?
Sure.
For people overweight, BMI like 36 or 30, those high number, is any help can come from?
Well, in my experience, 90% of the patients who come to see me at least lose 10 pounds of weight once I correct their gut microbiome, because the gut
Yeah.
microbiome is what produces GLP.
Yeah,
And we're now giving people GLP-1 agonists, and it's basically your microbiome.
yeah,
And it's ghrelin, and all the hormones are produced in the gut.
yeah. Especially for some people, they're very hard to lose weight
Correct.
by traditional way.
Exactly. And that's by attacking the gut dysbiosis, that definitely will help.
Okay, so we can visit you for that.
Oh, you can visit me for the test.
Okay.
But am I, going to give you GLP-1 agonist? No, I don't do that.
Okay,
I will refer you to the obesity doctor.
that will be fine. Yeah, thank you.
Yeah.
Thank
Oh, suddenly the questions come.
Thank you.
Food for thought.
Hello.
Will you
I wanted to ask a question about how does the microbiome affect the eyes, or how does the eye affect the microbiome?
Well, the eye has a different microbiome. Like the mouth has a different microbiome. Are they all interconnected? The mouth is definitely connected to the gut. But the eye is a different separate microbiome, like any other mucosa in the body. But the mouth is in direct connection to the gut, not the eye directly. Unless you have something like scleritis or uveitis, which you can find in patients with inflammatory bowel disease. Sorry, forgot to say that, yeah.
So going back to your comment about allergies, do you work with allergists then, and so that you test the patients for their microbiome in the gut, or how does that?
So I do different testing. They can be IgE testings, they can be IgG testings, they can be something called LEAP MRT, which is like basically the lymphocytes swell up when they're, or the cells swell up when they're exposed to certain antigens. So I do order food allergy testings. There are sometimes cross-inhalant allergies, like certain ragweed might react with certain foods in your body. So that is usually with the allergist that does all that skin prick testing.
I guess the follow-up is, if you've already had all of this skin prick testing, then
If you've had what kind of testing?
you had all the skin prick testing, so you know what you're allergic to in terms of foods.
Mm-hmm.
However, but you also have all these other things going on as well. Is there a possibility that it's more gut-related than it is?
Absolutely. Increased intestinal permeability is usually, it happens when you have patients who come in to be with multiple food allergies. Their gut is usually a very leaky gut. And that allows all the allergens to go in and cause the inflammation. So healing their leaky gut will help reduce their food allergies.
Your last question?
Okay. The difference between pre and probiotics.
Okay, so prebiotics are like non-digestible fibers that we intake in our body, which provide fuel to the gut microbiome. So the same way as we need carbohydrates, fats, and all those things, our microbiome needs fuel. And the prebiotics are those non-digestible fibers. Probiotics are actually, I'm sorry, go ahead. So prebiotics are things like hickory, Jerusalem artichoke. So they're found in garlic, onions, in all different kind of foods. They can be also found in supplements like partially hydrogenized guar gum, acacia fiber. Psyllium has prebiotic fiber in it. So those are the prebiotic fibers. Probiotics are actually bacteria that when we ingest, they actually help with the microbiome. They not essentially do we have to give probiotics to everyone. But in people with, say, commensal deficit, the microbiome is not that diverse. Those are the people who might benefit from probiotics. Certain probiotics counteract certain bacteria in the gut, which are pathogenic. So it has to be a personalized, targeted approach. It cannot be generic probiotics. And now there's something called psychobiotics, too. So just think about that.
I don't want to think about it. Let's thank Dr. Sachdev. Thank you all for coming. It's a great evening. Thank you.